On the Aetna Provider Portal for Behavioral Health, the Search by Code tool tells addiction treatment providers no pre-certification is required, and for behavioral health diagnoses, that answer is misleading. When you enter addiction treatment codes, Aetna's tool returns pre-certification not required for all of them. The fine print tells a different story. Here is how Aetna handles pre-certification for addiction treatment, what the portal tells you, what it doesn't, and what every biller should verify before admitting a patient. We cover who Aetna is, which services require authorization, which ones don't, and why the portal's search tool can mislead you. Aetna is a major behavioral health payer and a CVS Health subsidiary, with more than 22 million members a year. Aetna is a managed healthcare company covering over 22.1 million members per year, so its rules shape a large share of your admissions. Aetna uses pre-certification, pre-authorization, prior authorization, authorization, and certification interchangeably. They all mean the same thing. Ask permission first. Aetna generally requires addiction treatment centers, participating and out-of-network alike, to obtain pre-certification before admitting a patient. The obligation applies to participating providers and out-of-network providers. Skip the authorization and the admission is exposed before care even begins. Aetna has faced suits over underpaying out-of-network claims, which can leave centers chasing large, often uncollectible patient responsibility balances. Behave Health's revenue cycle management service is designed to handle Aetna authorizations end-to-end, and we only work for behavioral health providers. Verification of benefits, which includes the prior authorization, is designed to confirm coverage and secure the auth before admission. Behave Health maintains strong working relationships with every major insurance company in the United States and works only for behavioral health providers. Per Aetna's behavioral health pre-certification list, these services always require pre-certification or authorization, assuming the member's plan even covers them. 5 categories of behavioral health service consistently require authorization. Let us walk through them. Inpatient admissions for addiction treatment always require pre-certification. Inpatient admissions sit at the top of Aetna's always authorized list. Confirm the auth before the patient is admitted. Residential treatment center admissions require pre-certification. Residential treatment center admissions always require authorization under Aetna's behavioral health list. Partial hospitalization programs require pre-certification. Partial hospitalization programs are on Aetna's always authorized list. Secure the auth before the PHP starts. Applied behavior analysis and transcranial magnetic stimulation also always require pre-certification. Applied behavior analysis and transcranial magnetic stimulation round out the services that always require authorization. Beginning in 2019, state and federal laws required Aetna to discontinue pre-authorization for 2 levels of care. Intensive outpatient, level of care code H0015, should carry no in-network pre-certification requirement from Aetna. Outpatient detoxification, ambulatory withdrawal management, code H0014, was also removed from the pre-authorization requirement. Aetna's website has a search by code function that claims to tell you whether a code needs pre-certification. For behavioral health, it is not reliable. Enter any addiction treatment code, and the tool reports pre-certification not required, because the code isn't on the medical pre-certification list. The footnote admits the same procedure may require pre-certification for behavioral health diagnoses. Our recommendation: don't rely on the search tool. Behave Health's revenue cycle management is designed to cover every component of addiction treatment billing, so authorizations and follow-up don't fall through the cracks. Verification of benefits, including the prior authorization, is designed to lock down coverage before admission. Utilization review is designed to support medical necessity and payer communication through the stay. Billing and collections, patient responsibility, and denials and appeals are all handled by specialists who work only for behavioral health providers. Stop trusting Aetna's search tool to tell you what needs authorization. Book a 20-minute demo at behavehealth.com. See Behavioral Health Only Revenue Cycle Management built for Aetna authorizations and appeals at behavehealth.com.